Welcome to Dialogue with the Doctor. This is our 8th season, and tonight we're just doing an educational segment about our program for physicians so that they understand what we do here and what we can do for physicians and for their practices. We've done the show, as I said, for 8 seasons. My name is Dr. Gregory Leach, and I've done it with my co-host, Jim York, here. And Jim has done most of the work, almost all the work in production and organization and getting everything set up. And what we do is we interview physicians about their practices, about what they do in general in their practices, but also, depending on the physician, some of the subspecialty items that they do, or even some of the cutting-edge techniques that they use. Including research protocols, etc. So it's a way for a physician to introduce himself to the community if he's new, but even if he's not new, to let patients know who he is. And the face-to-face, on-camera component is extremely important for patients because they get to see who we are as physicians, who you are as a physician. And that means as much or more than any credential that is written on a piece of paper, because there are many physicians who have equal credentials or appear to have equal credentials on paper, but there's a tremendous amount of difference between physicians when you meet them.
Yeah, and I think, Dr. Leach, maybe you mentioned to the physicians that are watching this about, when you interview them, it's just like really interviewing a patient. It's nothing that's, scary or anything. It's been you interview them about also their practice, but you also interview them about a certain kind of illness that's maybe they're treating that can be also. Right.
Yeah, it's not scary. It's about as scared as I am right now. I mean, it's just a conversation, and physicians are very good at conversations because all they're doing is having conversations with patients.
Right. And
it's teaching. That's all we do is teach patients. So I think physicians, once they get used to the fact that there's a camera around, they just ignore. If you ignore the fact that the camera's around, we do a lot better, all of us, when we're being interviewed or interview. It's very comfortable and it's easy to do.
Right.
And it's
I think the other thing is you maybe could mention to the doctors about some of the things you've learned from the shows that we've done in the past.
Well, as a family practitioner, I see everything. I certainly, of course, don't know everything, and the specialty fields are changing very quickly. And so I've learned a tremendous amount from the physicians that I've interviewed. We've interviewed gastroenterologists talking about the latest treatments or research in GERD, and in hepatitis C. We've also had physicians talking about the biome of the gut, which is the holy grail of research these days.
Right.
I think it's where 20 or 25% of metabolism goes through the gut. And urologists that specialize in female needs, bladder tagging, suspensions, etc. Also urologists for male needs.
Right.
We've talked to radiation oncologists about their the way they're doing practicing their craft now, which is because we see so many patients in Naples of a certain age, especially for prostate cancer. I mean, they have the best technology here now with the GPS guided, follows the movement of the prostate and turns the beam on only when the prostate's in the field, and it reduces side effects and radiation exposure. We've had podiatrists and still plan on having podiatrists.
That's right.
Surgical podiatrists here, orthopedic foot and ankle specialists. And that's a very underserved field. So I've learned a heck of a lot. I know it teaches me how to better refer because I know what patients need and where they're going. So that's been good for me.
Well, the other key thing is, Dr. Leach, is we've done this for obviously for 8 years now, and that you know, the marketing of the program is kind of unique. That the doctors can have a couple different options. They could just be on our website, and being on the website, they could be just listed as a preferred doctor, and then secondly, they could be do a video like this with us and be on our website with the video. Talking about themselves, talking about, you know, a certain kind of sickness that they treat. And then the third option that they could have if they wanted to was take the video that they did here and put it on our television program on Sunday mornings. So they have 3 different options to do. And this show is marketed to the public, and it's marketed to realtors, over 5,000 realtors in the Naples area. And we also are going to have an ad in the paper every week promoting the website, so people from out of town that don't know where to go can go to the website and see the list of doctors, look at their bio, and also look at the video and meet them on video. So it's almost like, in a way, one-stop shopping. We've tried in the past, maybe you want to mention to the physicians that we've done in the past, we've never duplicated a subject. So, you know, if we have a, you know, urologist in talking about prostate cancer, we don't have another urologist in talking about prostate cancer either. So it's usually, you know, each season we've targeted one particular subject or one particular specialty talking about that subject.
I think what you said is important to understand in marketing now. The internet and the way that patients will access us is completely different. And they want to see who we are. They want to see our face. And we're being advised now that video presentations on our website is really what people want to see. They want to see what you're like. So these video presentations are usable. They'll be on the Dialogue with a Doctor website, but as you said, it can be on your own website.
Exactly. A lot of the doctors have done that over the years, put it on their own website.
And more than 50% of patients access way over 50% of patients access my practice via the internet. And so it gets a much more touchy-feely, close, personal view of what the physician is like in person.
Well, Dr. Leach, if any of the physicians that have seen this video would like to contact us, we have our email address right on the screen here, and if they'd like to contact you, I'm sure you'd be more than welcome to take their call or take their email from them, and hopefully all we're trying to do is bring awareness and doctors to help people in the community. There's over 10,000 homes being built in Naples right now, or the Collier County. So there's going to be a lot of new people moving into the area, and they're going to be looking for physicians. Obviously, I do a real estate show, local real estate show here on TV, in that you know, I'm always getting inquiries, as well as being a realtor, of, you know, what doctor to use or who should I use for this, and you know, I recommend obviously as many as I can, but this gives them another venue to that I can send them to go to the website, and here you can you know, meet the doctors on our website through a video.
Yeah, this kind of networking is extremely important, and the accessing physicians, as I said, through the internet and through electronic means, social media is the way things are going. I think it's very useful. Very useful.
Well, I think we've given our people a rough idea of what we do, and if they'd like to contact us, I think they can just email us, right?
And I would be happy to speak to any physician that wants to just talk to me direct. Physicians like to talk to physicians many times, and so just call me up. I'm in the phone book. I'm on the internet. You can find me. Right. I'd be happy to talk to anybody. Okay. Or they can go to the website. That you just published, the email address, and we'll just let you know whatever you need to know.
Thank you.
Thank you.